Normally the presentation of the fetus is important. The normal delivery, we find the baby presents with the head presentation, cephalic presentation. At sometimes there might be breech presentation or the hand or leg presentation, where the buttocks or the hands and legs will come as the first part. So these are abnormal presentations. So during delivery or during the later trimester, what happens, a physician or the maternity assistant will do a kind of manipulation called as external cephalic version, where they try to move the position of the head towards the lower end of the uterus, meaning towards the cervix. This is called as ECV or external cervical version. Sometimes at the time of delivery, the doctor might do a version manually. So this is called as an internal cervical version. Some female have a problem with their cervix where they have an incompetent cervix, in which case the cervix tends to dilate during pregnancy. This is not supposed to occur when a patient is pregnant. So in order to treat this condition of incompetent cervix, the physician does a service called as a cerclage of cervix. Here what he does is, he is going to make a suture around the entire circumference of the cervix, so that the patient will not have a cervical dilatation and this would not jeopardize the pregnant uterus. You should understand the same service can be rendered whether the patient is during the obstetric phase or during the non-obstetric. Accordingly, you will have to select the codes. There are certain female patients where even I myself have seen where they used to have the cerclage being continued 2 or 3 days prior to the delivery, because till that time there is no guarantee like what happens if the cervix automatically opens. So when the child is also immature, so there might be complications occurring. So in that case, you'll have to look after the patient very carefully, where the cervix should not dilate, otherwise it will result in a abortion. Okay. So cerclage occurs in 2 ways, as obstetric and non-obstetric.